This is Scott Becker with the Becker's Healthcare Podcast. Thrilled today to be joined by Dr. Cyr. Dr. Cyr is going to talk to us about his book, what led to it, his career, what he's most focused on, and a little bit more. Dr. Cyr, can you take a moment and introduce yourself to the audience and tell us a little bit about your book, your practice, and what you do?
Sure. Yeah, my name is Cyr. I'm a fellowship-trained orthopedic spine surgeon. I performed my fellowship training at the Mayo Clinic, which was a combined fellowship for spine surgery in both neurosurgery of the spine and orthopedic surgery of the spine. I attended medical school before that at the University of Texas Health Science Center in San Antonio. I spent many of my years in San Antonio, and so I'm kind of a Texas guy, but I also grew up overseas. My father was in the military. When I got into medical school, I was given an Air Force scholarship. So with that, when I finished my medical school education, I entered the Air Force at Wilford Hall in San Antonio as well, and then was admitted to the residency program at Wilford Hall, and then ultimately the fellowship that I discussed earlier at the Mayo Clinic. I returned from my fellowship back to the Air Force, where I was the chief of spine surgery for the Air Force and the consultant to the Pentagon and the Surgeon General of the Air Force during the rest of my time in the military. I spent 14 years on active duty in the Air Force and spent 2 tours of duty in Iraq during the Operation Enduring Freedom in 2006 and 2009, kind of in the heat of that battle. I was deployed to Balad Air Base in Iraq. And in 2010, I left the military for full-time civilian practice. But because I was in the military and I was a staff surgeon at the heat of the conflict in Iraq, we were given commander approval to moonlight. So I began moonlighting downtown to maintain my proficiency and to build on my proficiency after my training. And that's when I started to realize how tough the industry, the medicine side, the business side of medicine was outside of the military. You know, that we have our own issues inside of the military and the hierarchy of academic medicine, you know, coupling that with the military. But then when I got into the business world, I realized the challenges that physicians, especially private physicians, are facing. And I went through multiple trials. I had so many issues that I faced, and then I saw that I felt like the things that I experienced should never be experienced by physicians. And I felt like the system was at fault, that there was a lot of things wrong with medicine in America today that needed to be brought to light. And as a physician who feels like, you know, his story is important because what I went through should never have been experienced by anyone, but let alone someone who is in my role in the military, and that my experience, I never entered the military thinking that I was going to make a lot of money. I never entered medicine with a goal of making a lot of money. But when you're in private practice, you have to be a businessman to some degree. And that's where I think the problems that we see are being faced. And so my experiences and my trials and my failures and all of the things that I went through, I felt like they had to be chronicled for people to see. Number one, sort of as an expose to other physicians who are getting into medicine or who are practicing medicine now and haven't had those experiences, to protect them from making the same mistakes that I made, to give them some guidelines on how to protect themselves on the business side of medicine, but also for our patients, which is everyone in America, to realize the battles that we face and that we fight for them every day to try to maintain control of their care. Because frankly, we've lost control of medicine, and physicians are not in a position to even improve that the way things stand. So I felt like it was important for America as a whole to understand what's happening to physicians, because I think it's been hijacked. Medicine has been hijacked by the business people in medicine, and federal indictments and, you know, bankruptcies and everything you can imagine. If you look at the headlines, you guys are publishing important headlines all the time about what physicians are seeing and what they're facing. In 2021 alone, the DOJ collected $5 billion with a B in healthcare fraud claims. And it just tells you that there's a big push to finding fraud. And the real question is there that much fraud, or is the system flawed? Or is it a combination of both? And so,
and probably some combination of both. So tell us for a moment about, you have a new book out called Cutthroat. And let me tell us about the book. And I know it's available for pre-order. Tell us a little bit about that.
Yeah, so Cutthroat is a book. It's entitled Cutthroat: A Surgeon's Fight Against Big Government, Corrupt Businessmen, and a Flawed Healthcare System. But the idea is that, like I said, I describe my experience, my background, who I am, what my experience was, who I was, my role in the military, and then my position outside of the military, and all the things that we went through. We went through anything and everything you can imagine. And I say we because I mean me and my wife. We are in the practice together. But we went through every single trial you can imagine in medicine. And I felt like chronicling that and explaining that to the public was important. So the book goes back to my early childhood and my life, and what drove me into medicine, what inspired me to become a military medical officer, and then how I created a practice and all the things that we faced in that attempt to practice medicine. And then it talks about some of the things that we're seeing in medicine, the Stark Law, anti-kickback, now RICO laws. None of us ever felt like we had to protect ourselves from RICO laws, which was intended for the mafia, but apparently we do, because they're coming after us for RICO law violations now. So I think it's very important for physicians to know and for patients to be aware of what's happening, because I think we need to regain control of medicine. And the only way that patients are going to get good care is if the people who care most about them, in my opinion, the physicians, are in control of those things. We have multiple businessmen that are violating the corporate practice of medicine doctrine, or at least the intent of it, through loopholes which allow doctors to be employed by big corporations, peer-to-peer reviews that are being conducted by insurance companies and doctors who have never seen patients who are controlling or denying or rationing care. And I just think these things have to be brought to light. They have to be explained. And so Cutthroat is my attempt, through my own personal experience and narrative, to explain the things that can happen to you as a well-intentioned doctor, and anything that possibly you can avoid. There's some advice in there of the things that I did maybe incorrectly, or the mistakes that I made. And then also just some guidelines on what I think should happen in order for physicians to regain control for the sake of patient care.
Thank you very, very much. And I guess, Dr. Cyr, the most important question: Cowboys fan, Texans fan, Spurs fan, Mavericks fan. You're a Texas guy now. Where are the sports loyalties? Where do you line up today with the sports? Astros fan? Where are you at?
Well, for a long time I was actually the Spurs spine surgeon, so spine surgeon to the Spurs, and so of course my heart's always going to be with the Spurs and that team of old in the 2013, 15, 17 era, where they were winning everything and they were at the top of the world, and we had Tim Duncan and David Robinson, everybody kind of ruling the roost. But I've always been, from the time I was a little kid, been a Cowboys fan, to be honest. So Cowboys and Spurs, I think I'd go with those two.
So nothing wrong with it. Cowboys and Spurs guy. A Jerry Jones fan, not a fan. Where do you come out on Jerry Jones?
Ooh, man. Well, I could tell you he's successful, and I applaud his success. I think I think everybody who loves the Cowboys would like for him to let the coaches coach, but he's clearly successful. So I don't think I can criticize a guy that's done that well. So yeah, I think he's doing all right.
No, and he's going to choose to do it how he wants to do it. And what about Greg Popovich? What about Popovich?
Well, I think he's an amazing coach. I mean, he has sustainability. He's the winningest coach of all time. He most recently was given that acknowledgement. And obviously, when he had the Spurs, he had the best players that were moldable and that were teachable, and that really played like a team. So I'm always impressed with his statistics, considering he didn't have the most athletic team, but we did have some of the most successful teams in the history of the NBA. So I respect Popovich's skills for sure.
Magnificent. Dr. Congratulations on your regaining control of your career. What a magnificent career in so many ways, some challenges. Thank you so much for joining us today to talk about your book, Cutthroat. Where can people find the book? Where will the book be available?
So the book's available right now for pre-order on Amazon. And just a little statistic right now, we're #1 for new sales in surgery and also medical reimbursement. So we're real proud of that statistic. It still hasn't been released in hard copy yet, but it should be coming out early May. But it's available for pre-order now. So please, you can order it on Amazon. Probably the easiest way to keep up to date with what's happening with the book is our website, cutthroatbook.com. That's CUTTHROAT book.com.
And for those of us that are getting older, if we want to listen to the book on tape or something like that, at some point will that be out on tape, and then will you be narrating, or will we get somebody else?
Well, I would love to have narrated, and I think I could have done it, but it would have taken a very long time from what I hear from the publisher. They actually recommended having someone who could devote the time to it. And the audiobook is done. So it will be available very soon, as well as probably at the same time that the hard copy is available, the audio version will also be available.
Magnificent. Dr. Cyr, thank you so much for sharing your story with us. I know we didn't get into details, and I know there's been challenges, but I love the resilience and writing about it and so forth, and a system going awry. thank you so much for taking the time to visit with us today. We'll get this out in the next couple of weeks. Thank you, sir.
Thank you very much, Scott. All right, take care. Bye-bye.